All right. Well, thank you, Matthew, and welcome everyone. I'm so glad you're here. I think we're going to have some really good discussion about these important topics at this especially important time of year, which is so complicated by all the challenges we're dealing with right now, right? All right, let's get started. I wanted to go ahead and start thinking about the issues of substance use disorder and suicide and wondering about the data. So Kate, as our resident epidemiologist, I wondered if you could talk to us some about the data around these issues.
Had to find that sneaky unmute button. Move my water bottle down here. Definitely. So would you like me, let me just ask off, would you like me to kind of include some COVID information, or should we keep it separate?
Oh, sure, you've got free reign, just go.
All right. So August, so I'm Kate Durst. I am the Office of Information Analytics, as Matthew said. I will probably shamelessly promote some of our existing reports and materials as they're super helpful. And that way, if I kind of trail off or get sidetracked, feel free to go and reference them later. So in August this year, we were able to put out our 2019 mortality report. And we found that 2,089 Tennesseans died of a drug overdose in 2019. And that is a 15% increase from the previous year, 2018. And our current provisional data shows that through 2020 and COVID-19 that we are on track to exceed that 2,089 number. And so kind of within that, there's a little bit of a few layers. We like to look at a lot of those different types of drugs that individuals have unfortunately overdosed on. And ones that we routinely kind of talk about are prescription drugs and then illicit drugs. So we did see that continuing into 2019, that those prescription drugs have declined and that drug overdose deaths due to prescription drugs have declined. We've also seen an increase in illicit drug overdose deaths, and that being primarily involving two drug substances, fentanyl, illicit fentanyl, and then also psychostimulants, which is a big fancy word, which largely includes methamphetamine. So that kind of has also continued in our trends as we see people who have had non-fatal overdoses in 2020. Those are kind of the two routinely seen substances that we are coming across and seeing increases in, again, illicit fentanyl and methamphetamine. And so that is kind of a big kind of blanket over a lot of the data. However, one thing that I really wanted to kind of wrap back to is our office has a really routinely used motto, and I think the motto is kind of why we're here today, and that is that numbers count and every number is a story and every story is a person. And so just kind of bringing it back around to the fact that we're here to talk about those lost stories and the fact that a lot of those lost stories are completely and 100% preventable. So what we can do to then, again, build this idea of resiliency and turn it into preventable overdose.
Oh, thank you. I like what you were saying, especially about lost stories and thinking about the actual individuals affected. Will, when she was talking about fentanyl and methamphetamine, it made me kind of want to think about you and your work. Tell us what you're seeing out there in terms of those substances.
Yes, ma'am. So definitely we know with the new or past legislations, cracking down on the opioids, we've seen a illicit drug trade definitely increase. And of course, the fentanyl being such a potent substance and pretty cheap, as far as on the street market. So it's being mixed into with a lot of other substances. Actually in our rural areas, we've actually seen it mixed in with some methamphetamines. That substance is so strong that, of course, being mixed by our street level dealers and things like that, it has increased the overdose numbers. Sitting and kind of working in some of the areas surrounding Davidson County, there's been reports, everything from marijuana to, like I said, methamphetamine that have been laced with that fentanyl.
Right. Thank you for sharing that information. And I'm wondering about the whole suicide prevention angle and the information about suicide. So Misty or Brittany or both of you, talk to us some about that and how substance use disorder and the overdose situation, how that all intersects.
Brittany, you want to take it first and I'll follow up?
Yeah. Thanks. Sure. Yeah, so kind of like Kate, I'm going to shamelessly talk about some of the reports that we've done. So here at the Tennessee Department of Health, we do have our first suicide prevention annual report that was released this year. And similar to what we see with drug overdoses, unfortunately in Tennessee, we are seeing an increase in suicides across the state. So in 2018, we saw 1,159 people die by suicide across Tennessee. And unfortunately, in 2019, and these are just recently released numbers, we saw 1,220 people die by suicide in Tennessee in 2019. So that is a 61% or 61 count increase. And what Kate says, I think that that's really important, but behind every one of these numbers, there is a life, there is a story. And so 61 additional lives were lost to suicide in 2019. And when we think about, substance use and misuse, that is a huge risk factor for suicide. And mental health issues and substance use and misuse are both identified risk factors for suicide. So I think addressing both of those things in a prevention world is really, really important.
Absolutely. Misty, do you have anything to add?
Yeah, I would say, I think in addition to, the suicide prevention work happening across the state and the incredible reports that the Department of Health and Brittany's department have been able to release and be able to provide that data from 2019, we want to make sure that we're also focusing on what resources are available. I think, and Brittany can add in on this as she sees necessary or wants to, but I think we are seeing an increase in the number of people reaching out for help. And I think that goes to show, kind of tying that back to the theme, that we can be resilient and that we can bounce back from hardships. And being able to build those resiliency skills within people is something that I know TSPN is going to work very hard on in the upcoming months and year.
Awesome. I love hearing that. My work is all peer support based, so I get really excited about talking about resiliency. And I predict that one of the odd sort of benefits, I think, of the global pandemic is I think we're going to see a reduced stigma coming out of this for seeking mental health assistance. I really do. Everybody's talking about it. That gets me really excited. Will, I'm looking at your smile on that. What are your thoughts about stigma and reaching people and getting people to reach out for help?
Yeah, I definitely agree with you, Miss Lisa. When we talk about resilience, I kind of look at the duality of it. A lot of times we look at resilience as kind of, I know when I picture it, I would picture the action figure of my time of kind of the Stretch Armstrong. But although being able to bounce back and kind of the duality factor of being the shield, I also look at it as being a sword too, and being able to persevere in these times. And definitely the current circumstances with COVID and things, and having to go to new extremes, maybe. I'm not saying the new norm, because I'm definitely not accepting those terms yet, but adjusting to the circumstances and having to get creative with ideas definitely is going to increase individuals sharing their story and getting their stories out there, because we're all in recovery from something. Yeah, we're talking about substance abuse and suicide today, but ultimately everybody has a recovery story. And in these times, having that social instinct and being able to share those factors with each other really is what builds that resilience. And I think definitely we're going to see an increase in that, in the I call it the demoralization of that stigma and just getting rid of it.
Nice. I agree. Let's talk a little bit more about COVID-19 and how that has affected everyone's work. I'm just going to open up to the four of you. Anyone who wants to speak to that, how your work has changed and what you're seeing with the global pandemic.
Sure, I'm happy to kind of start this off. So suicide and mental health issues were really a major concern at the start of the pandemic. Obviously, they're still very much a concern, but when the state locked down, that was a huge concern of Governor Lee, pushing. I'm worried about suicide increasing. I'm worried about mental health issues increasing. So we started a weekly report in response to that concern, where we are looking at suicide deaths, emergency department visits of suicide-related behavior, as well as our crisis calls. So in partnership with Department of Mental Health as well as TSPN, and our crisis text line calls. And we've been following that weekly to really see, what that looks like in comparison to 2018 and 2019. And to similar to what Misty was saying earlier, we are seeing an increase in people reaching out. So that is something that, is positive. And we are seeing people, have more awareness of mental health issues, of needing to reach out for help in a time that they're struggling. And that, to me, is what resiliency is all about. And so I think that really spreading that awareness is really important. We need to be making awareness, suicide awareness, substance misuse awareness available in our community. We need to be spreading these resources because, as we can see, mental health and substance use is increasing in response to this COVID-19 pandemic. But we are looking at this really closely and monitoring this really closely in partnership with Department of Mental Health and TSPN.
Yeah, and I'll piggyback off that, Brittany. It was a great kind of tee up for me. What we're seeing with the crisis text line. So let me explain this for those that may not have a true understanding of the crisis text line. So we have a keyword partnership with the crisis text line, which means that we promote, as you can see here, to text the letters TN to the number 741-741. What that does is it allows us to capture data. We have essentially a data dashboard that we log into remotely, and we're able to gather all types of really incredible data points and information that allows us to then target our prevention efforts. So for example, because we have this keyword partnership, and I will tell you, I think we're the only entity in the state that has a paid keyword partnership, which means that we get access to the data. So whenever you see another organization or entity using a different keyword, more than likely, they're not getting any data from that. They're not getting any feedback from it. So some of the really great data points we're able to access on this platform is how many people are texting in, how many conversations are happening, and what's the substance of the conversation, the text conversations that are happening. And, the top 4 since January 1, the number 1 issue has been depression and sadness. Second was anxiety and stress. Third was relationships. And then 4th was suicide. And so what we're able to do is take that information and say, okay, of these people who are texting in, reaching out for help, what can we do to help educate the community on warning signs and risk factors? We're going to start tailoring our trainings to depression and sadness and what that looks like, and what the warning signs are, and how you can talk to someone. What is it, how important are relationships in our community right now, and how that impacts suicide prevention? We know that suicide is the 2nd leading cause of death for kids age 10 to, adults age 34. And that's something we really need to work on. We also know the correlation between substance use and suicide and how much they overlap. I feel like I'm going into a training, so I'm going to scale back just a little bit. But we also know that, suicide prevention is important. And one of the things we have done at TSPN to adjust to COVID times is now offer virtual trainings. They're still free, they're still no cost, but we are able to deliver a majority of our trainings virtually. And we've been able to do that, and we will maintain that even moving into 2021. So yeah, I'm going to stop there before I go into training mode.
Well, I welcome your training mode. I was all sucked in listening to every word. Kate, I'm wondering about your work too, and how COVID-19 has affected what you do.
Definitely. So kind of similar to Brittany, I feel like at the beginning of the pandemic, there was a really big concern, and there still is a concern, but there was a big push to look at overdose numbers and kind of check in on different communities that we know have traditionally had higher counts of non-fatal and fatal overdoses across Tennessee. And so we too have created some additional reports that are kind of internal metrics that we share with key partners across leadership and across different agencies and divisions in the Tennessee government. And that's really been one great opportunity for us to kind of practice our resiliency, our ability to, in adversity and in these tough times, turn and almost create growth within our office, to create new products, new creative ways to look at the problem, and then really come up with new solutions and new partnerships. So that's been something that's been almost, I think, a really positive outcome of quarantine and COVID lifestyle. We've really had this opportunity to reach across, and it's been really positively supported on both sides of the Tennessee Department of Health and Mental Health, being able to kind of cross collaborate almost frequently, and so frequently between this and then the International Overdose Awareness Day. I think that these are things that we would have dreamed of doing, but I don't know if we weren't at home, we would have really been able to accomplish. We also just within our own office have really, and I personally want to shout out all of our partners who are at hospitals, who are reporting all of our DOR data. They've really practiced resiliency, and we've seen that from them. They are completely slam dunked with, so many things going on. And we have had almost no hospitals drop off reporting and stop reporting to us. They understand this is a priority, and they've continued to make it a priority. And on top of that, our actual, our tool, our surveillance system that we use to collect information and data was actually going through a transition that was already difficult when COVID struck and when things were going on. And our partners have been so incredibly wonderful at continuing and pushing through and making sure that we get this important, really real-time information. And then our team has even turned around. And so again, shameless plug, we have now produced non-fatal overdose briefs that are monthly briefs that you can see on our website. And that's something that you're able to kind of better understand. We do a comparison between counts by month for 2020 and for 2019, and you can kind of get a sense of just our general increase in non-fatal overdose. And you do see that kind of peak from March to July of 2020, of where we do see increases, which could be attributed to that more quarantine, isolated time period that the state was going through. But overall, again, like I was saying, just a really unique opportunity to really change how we are doing things, shake things up. That's really pushed our team. And then I would say our visualizations, our data, our reports to kind of really go to the next level, which has been a nice positive outcome.
It's so exciting to hear you say that your providers are sending in data just the way you need. That's not something you always hear, It's something to celebrate. When you were talking about non-fatal overdoses, and that made me think about Narcan and the Narcan distribution and training that we've been doing, which brings me to you, Will. Can you talk to us some about Narcan and what that's like in your work?
Yes, ma'am. So we've had to get creative again, just with how we're going about distributing and training individuals on overdoses and Narcan. We offer that training virtually, but also a lot of our team across the state have been doing just outreaches, kind of what I refer to as maybe pop-up tents in some high trafficked areas and things, just to get that information out there. We also have a group that of our team that really focuses on some high risk areas that we've known using going on, or maybe even some reported overdoses in certain areas of different counties and things. We really try to target that just to get Narcan in the hands of individuals that are high risk of overdose. Also just working with different partners, TSPN, even, providing and trying to assist in some of those trainings and things along. We do a collaborative effort where we may offer a QPR suicide prevention training along with a Narcan training together while we have, you know, a population or a community together at once there. So just a collaborative effort and really a lot of creativity going in there of just dealing with the current circumstances. So.
Wow, that's awesome. And I am hearing so much collaboration and partnership, and I love the way this is all dovetailing together in your work. Let's talk more about resiliency. And I'll just open it up for whoever of the panelists will respond, but share with us what resiliency means to you and why it's so important.
All right, I'll take a page out of Brittany's book and start us off.
Thank you, Missy.
Yeah, absolutely. So for us, resiliency, I mean, if we think about it, just the very definition of it is the ability or the capacity to recover, sometimes quickly, sometimes, you know, it depends, but the ability to recover from difficulties. And everyone knows this year has been a very difficult year for Tennesseans as well as the nation. I mean, we look, you know, just at our state alone, though, on top of COVID, I mean, we had some really destructive tornadoes hit, you know, in multiple parts across the state. So not only did we have people who were immediately homeless and had no food and no shelter and no clothes, now they're faced with this pandemic of COVID. So it was just back to back to back to back. And again, thinking about just the very definition of resiliency and having that ability to recover quickly from difficult situations, what we're going to do is really focus and put an emphasis in our trainings on what resiliency is. How can we instill resiliency within people? How can we build their capacity to be more resilient regardless of what the difficulty is? So we're going to be incorporating ideas like how to cultivate a belief in your ability to cope with difficult situations and circumstances. You know, how can we stay connected with our sources of support, whether that's a human support or a four-legged support, or, you know, a book. What makes us feel good and how do we get more of that? Healthy feel goods, right? You know, and making sure we're encouraging people to talk about what they're going through. And someone said it very elegantly earlier where, you know, the stigma around mental health and going and talking to someone, we hope is going to be dramatically reduced, because it's almost as though we're all on the same playing field now, right? What we've all experienced, we're united by this COVID effect, let's say. And, you know, different people deal with it in different ways, and we all have different levels of resiliency, but I feel like we're all kind of on the same playing field now. And it's not, oh, you're going to talk to someone. It's more, hey, who did you go and talk to about this, right? Who helped you? And that network of referrals, you know, how can we help people cultivate an attitude of survivorship, right? And how does that go with being resilient, you know, and helping build someone's resiliency, you know, and talking about activating positive emotions. And so you're going to start seeing more and more of that from TSPN and helping Tennesseans or whoever decides to join our trainings build their resiliency, or even the resiliency within their communities.
And I think just to kind of piggyback off of that, you know, there's a kind of a beautiful thing about data, and just kind of that, again, I'm a big data-driven person. I love data. It really provides an initial talking point. It's something that is comfortable, it's kind of separated, but yet it's applicable to an individual. And it really allows people this ability to understand their risk and understand kind of where, you know, their age, gender, sex, race, like where they could fall into this data set, and provides conversation. Whether that's kind of, you know, internally with yourself and saying, you know, I see that my age group is specifically really high for overdose or suicide risk. You know, do I feel that way? Am I okay? Checking in on yourself. But also it provides a really easy conversation point to turn to a loved one, and turn to your significant other, your mother, your grandfather, someone you don't traditionally talk about these things with, and say, hey, you know, have you seen that in Tennessee, you know, those over age 65 are going through XYZ? And you can say, are you experiencing that? It just provides a really easy conversation, and it's less, I feel like, attacking or a little less stiff, a little less rigid. So just something that's nice.
I love your practical application of data. That's awesome. Brittany or Will?
Yeah, I'm going to I love everything that Kate and Misty said, but I'm going to kind of rewind it back to something that Will said, Stretch Armstrong. So when I think about resiliency, and this is going to sound incredibly cheesy, but I almost think about a rubber band, right? And you can stretch a rubber band a really long ways, and it can be adjustable and adaptable in a lot of different ways. You can use it in a lot of different ways, but after it's used, it bounces back. But also what happens when you make a rubber band ball, right? If you get one rubber band by itself, it's really loose and stringy. But if you wrap lots of rubber bands together and create a ball, and that's kind of what I think about as a community, that creates a really hard structure that is hard to break, right? And so that's why I think it's even more important to have these conversations that Kate is discussing with your friends and families. And I think that kind of what Misty was saying is we are kind of on an even playing field right now, where it's not as weird as it once was to be like, hey, how are you holding up through this? It really opens up a door for a conversation that people might not have felt comfortable having previously. And so that's kind of how I look at resiliency. And I really think that resiliency comes in numbers. The more that we can support one another and connect with one another, the better off that we are.
Thank you.
Yeah, and just to chime in with these ladies, and I really feel the vibes with Brittany. I feel like definitely we could go together on that mission, because that is so true. Being an individual in long-term recovery, you know, we are resilient individuals. A lot of times we're just overwhelmed, maybe with current circumstances, that we tend to forget how resilient we truly are. So, you know, me and my team, we've actually have been working on a project with individuals to get down and kind of hear their stories, their testimonies of sharing that resilience, because a lot of times individuals, like I said, tend to forget how resilient they are. You know, we look at resilience, or I should say, I look at resilience as being kind of a multifaceted. You know, that inner resilience is definitely having empathy and a problem-solving aspect, but then also it includes that others, you know, as Brittany mentioned, having, you know, that rubber band ball. I had to have those supportive relationships. And then the key to that is just a seeking balance into my life of work, rest, and play, which ultimately leads out to less or more, opens up alternatives on handling situations, which eventually would end to less stressful approaches or destructive paths. So, you know, working with individuals and really getting them to share their story, you know, we're doing a couple things by that. We're breaking the stigma for once, but then we're also cultivating hope for others during that time as well. And that's definitely what we need in these circumstances. So definitely, yeah, I'm on board with the resilience campaign.
I'm hearing that. And many of you have mentioned the resilience of communities, which brings me to a really interesting question we got from our audience. Amelia Aria is a researcher from the University of Maryland School of Public Health. I hope I got that right. And she is interested in community level resilience. She asks, what would you say is important indicators of community level resilience? And does it vary across counties in Tennessee? Who would like to take a stab at that one?
Okay, I'll start us off, but I'm not answering the whole question, okay? I would say yes, it definitely varies from county to county across our state. We have pockets of the state that are extremely rural, and we have pockets of the state that are extremely not rural and very urbanized. And so thinking about, for example, Davidson County, you know, what looks like a sense of community in Davidson County is not going to look like a sense of community in Murray County, for example. Shout out to the Curleys. And so being able to really understand that and know within the community what resiliency looks like is very important. I mean, almost to be culturally sensitive even, because, you know, again, what's appropriate in one county is not going to be appropriate in another county. And it's going to look very different. Even if we think about communities being resilient in the Cookeville and Putnam County area, you know, whenever they had the hard hit tornadoes, and even downtown Nashville, right? Whenever they had those hard hit tornadoes, that resiliency is going to be very different than looking at resiliency factors in a different part of the state that was affected by something else. So I don't know if that's helpful or useful, but that's my 2 cents. Someone else can pick it up from here.
I definitely will. So kind of on top of that, I definitely think even looking kind of similar in lines of rural versus urban, we have this insane, I think, kind of difference in age populations and general activities. So in thinking of how we're going to create materials and create content that then are helpful to these different age groups, I definitely think considering all of the different ways that we have different age ranges and different things that would be of interest to different people are going to highly vary across Tennessee, especially for those who are maybe in a more rural setting, which they want to have more family centric, especially in COVID times, which it's hard to encourage gathering together, but they desire those almost gatherings of multiple people and multiple families. And then you have more urban Nashville, where we do have the younger population who have different ideas of what they want to do on a weekend, and trying to find ways for them to help adjust and cope and create their own internal resilience, which having even that just younger population, you know, I, as a younger mid-20s before this, I didn't have a lot of opportunities to build resilience and maybe true resilience. You know, I went through college and grad school, and those posed kind of hurdles, but they had hurdles with ends in sight, not building and maintaining and sustaining this type of resilience that has then gotten me through COVID-19 and not knowing exactly when things are going to return to normal, or when I'm going to get to go and hang out with my friends on a Saturday night, you know, not virtually on my couch. So I think that those are just kind of some different ways that, you know, Tennessee is widely different. So definitely.
Brittany or Will, I don't want to move forward without checking in. Do y'all have any comments on that one?
I think they covered it well. I think, you know, when we're thinking about suicide specifically, and since that's kind of my program area, that's going to be what I speak on, but we think about rural areas and rurality. You know, people die by suicide 1.5 times more in Tennessee in rural areas than they do in metro areas. So the risk factors, you know, within those rural areas are definitely different than, you know, our urban areas. And so absolutely our coping and resilience will look differently in those areas as well. And so I think, again, we're talking about awareness, being aware of those resources available in the community, spreading that awareness and spreading those resources within those smaller communities, so people can know if they are living in a rural community, if they are feeling socially isolated, if they are feeling alone, that, you know, there is help out there. They aren't the only person feeling that way, and that there are connections to be made to kind of get them out of their rough spot.
And just to kind of touch on that aspect, that it's definitely different across the state, as Misty mentioned. But, you know, our faith communities have really stepped up into the rural areas and things, and providing an opportunity, an environment, and even resources for just to connect individuals. You know, we're really blessed with the state of Tennessee and our faith-based initiative to have that support from the top down, just to be able to implement and utilize our faith community. You know, that's the longest and oldest organization known to man, and yet they're getting the opportunity to do what the faith community is designed to do, to help individuals.
I'm glad you mentioned the faith community. That's such an important part of the work we're doing at the department right now with our own Dr. Monty Burks. Matthew, can I pull Dr. Burks in and ask him to speak a minute? Come on, Dr. Burks, tell us about faith communities in Tennessee and how it intersects with these issues.
Thank you for putting me in there. I was enjoying hearing Will speak, but I know most of the people on the call, but our faith community is kind of like can be a stitch in fabric, so to speak. They're connected to all communities, health, mental health, labor, education. Our faith communities, they're in every single county, every city in the state of Tennessee. They operate in areas where we don't necessarily have a stronghold or a resource. If we're smart, like we understand how to create these resilient communities, they need to be part of the sectors involved in this process. We need to discuss behavioral health and the whole continuum with our faith community. So when something happens, if we can't use traditional measures, Lifeline, ropes, TSPN, all of our navigators, we can all reach out to faith communities to get that driving message out. Hey, listen, this is an issue that's about to hit your community. This has already hit your community. Here's where the resources are in your community. Here's a mobile bus we have in your community. Here's a mental health resource we have in your community. Guess what? At the library, they have access to mental health services now. Bam. All of that can happen through effective and collective partnerships with our faith community. You know, you guys always know I share data. We have 12,000 faith and religious institutions. 87% of our faith community are involved in the Christian faith. The other 13% are involved in other parts and other pieces, other different communities. They all serve and can catch people from all belief systems, walks of life, or people who don't even have a belief system. It can benefit Tennesseans to understand that our faith community is a resource, connect them to resources, and respect them enough to bring them into the conversation. Whether you believe what they believe or not, it's irrelevant. You need to look at the sheer number and the size of our faith community and realize that there's such a resource. Now, I'm off my soapbox because this ain't my panel. But you guys all know that I've worked for years trying to figure out how to get the faith community involved. And we have to meet them where they are, just like they meet us where we are. And we have to understand that their institution, like Brother Will said, their institutions are older than the one we work for. So we have to respect the space that they operate in, and simply meaning that let them be a resource, if for nothing else, to the community that just they serve. So I'm off of there now. I'm going to listen in a little bit.
Thank you. I liked what you said about how they can be an additional resource. And y'all were saying the importance of letting people know what the resources are out there. We see that time and time again. Tony Jackson had an interesting question, and I think we've kind of covered it, but let's kind of go back to it. What are some really practical suggestions we can give folks for how to develop those protective factors that can help them build resiliency, especially in thinking about the holidays coming up and just the complicated times we're living in right now? I'll just open that one up. But Will, I'm kind of looking at you.
Well, as I talked earlier about the duality, and I'm going to kind of sidestep this because a lot of times, you know, I know myself, I view resiliency as being a shield, but I also like to view it as a sword and being able to persevere forward. You know, so how could I share that resiliency with others is, you know, by sharing my story. As I mentioned, you know, I'm an individual in long-term recovery, and sharing individuals, you know, my trials and tribulations that I've been through. Really what that does is that enables the individual or the peer that I'm working with there to really see that they can do it too. You know, I'm nurturing that hope and instilling that in them, which hopefully will be motivation. You know, but to step from the shield side of resilience to more of the sword side of resilience, I think that, you know, definitely it's a process that we have to go through. We have to process it before we progress it, you know, and what I mean by that is you have to, you know, sit and reflect in the circumstances. A lot of times we look at failure as, or a mistake as just being a failure, which no, it's not that. Yeah, it's that if we choose to view it as that, but really it's a learning opportunity. So if I process it and I sit and reflect on that before I progress, and progress means to me is that I'm always moving in a positive direction, sometimes quickly, sometimes slowly, right? But still nurturing and supporting individuals along that journey. You know, when we talk about substance abuse and really the correlation with suicide prevention, we hear that the overdose numbers and relapses and things, and I don't even like the term relapses because, you know, a slip doesn't have to be a slide. If, you know, if you're with an individual and you're supporting them with that, you're there to help pick them up and to support them along that journey to find long-term recovery. And that's what it means to me as far as, you know, sharing that resiliency piece.
To kind of piggyback off that, Will, which amazing, by the way, job super well done, friend. thinking about resiliency and ways to help people be resilient, I think sometimes, and again, going back to another point Mr. Taylor made earlier in the evening, so I'm just going to copy off Will all night, but thinking about taking a moment and looking at what we have overcome in the past. I think that can be a good reminder of we've been through difficult situations in the past, whether that's as a community or even on an individual level. If you're sitting with someone, you can ask them questions like, well, what difficult situations have you faced in the past? And get them to think about that, and then ask them, and how did you overcome that? That's resiliency. That there's power in that, in being able to help remind them, or poke a hole in the darkness and say, look, you've overcome this in the past. This is just something else that we're going to overcome. And in the future, we're going to look back and say, how in the world did we do that? But we did it, right? And another point to Will, being able to talk to others and share your experiences and things that you've overcome and how you've been resilient to offer hope and guidance and support to someone, whether regardless of what challenge they may be facing, if it's suicidality, if it's, substance use, if it's COVID, but being able to talk, whether it's on an individual one-to-one level or a community level, like what we're doing right now, right? So there's my thought.
Thank you, Misty. Absolutely. The power of sharing our stories. I'm all about peer support.
Yeah, I think, off of what Misty and Will said, I think sharing our stories is really where it's at. There's this really great podcast that I listen to called Terrible Thanks for Asking. And it's all about this idea of when someone asks you how you are, you feel inclined to say, I'm doing okay, right? Because you don't feel like someone wants to know the real answer of how you're doing. But if we could have more honest conversations about how we're doing and say, hey, terrible, thanks for asking, I think that could really benefit us in the long run, because we can encourage conversations about, hey, what's going on? And similar to what Misty said, like, what are some things that you've experienced in the past? How did you get through those things? And let's figure out ways for you to get through this as well.
That made me think of getting back to work this week after the Thanksgiving holiday, and people just naturally saying, how was your Thanksgiving? All happy and perky. And my response has been, well, COVID sucks. So it was okay, but it wasn't, I'm not going to glow and talk about how great it was, because COVID sucks, Matthew, I'm running out of questions. What do you have? I know you've got something.
I just can't wait to clip Lisa saying COVID sucks and put that on the Facebook page. That's going to be awesome. I'm really excited about that.
That's my permission.
I'm curious. What in the last 9-10 months, however long it's been. What have people learned? I'm curious, what have you learned? What have you done different personally? Like for you, what has been something that you've gone back to? Like for me, it's gardening. I love to garden. I grow tomatoes and stuff like that in my backyard. Love to garden. Just go out there, get dirty, get a little peace and quiet, right? Lisa, we did a thing with you at the start of all of this about painting, and it was the coolest thing. It's like watercolor. It was like we have our own Bob Ross here at the department, right? So I'm curious, just for the panelists, what has been something that you personally have gone back to over the last several months to kind of center and ground and find that peace?
Well, since I'm already unmuted, I will definitely take this one for the team. One of the things that I have gotten really into during COVID has going back to power walking. I'm a really pathetic runner, and I'm not afraid to admit it. So I get on like an 80s jazzercise kick where I'm like pumping the arms and walking around my neighborhood like I own the place. And it is just too much fun. And you forget just like how great of a time, like I can't go through it without laughing at myself and smiling. So that has been a huge, huge relief. And then on top of it, I've been really good about practicing kind of more on a personal level, verbalizing my boundaries. That's something that I've been that's changed a lot over the course of COVID is kind of admitting to myself where I'm at, how I'm doing, and not just saying it in my head, but really writing it down and then looking myself in the mirror and saying, you will not do this week, or maybe more positively, you will do this week. So that's something that I've really gone back to and relied on.
I'll go next. I'm a big nature person. So something that I've done in the social distance world is we don't have to be social distance from like trees and flowers. So I've spent a lot of time outside. I have a 7-year-old daughter, and a lot of what this COVID-19 pandemic, virtual school sucks. I'll tell you that. So I'll speak on that, Lisa. But what that kind of has taught me with having my 7-year-old here is spark my imagination again. I didn't realize how caught up we get in the day-to-day life of going to work, going to school, getting home, having dinner, getting a bath. And so, you know, if having a fort in the living room for 3 days is what gets us, you know, going, it's really, you know, I think being creative and sparking your imagination is a great way to create resiliency within yourself. Bring it back to those childhood roots and just be silly and laugh.
That's awesome. Thank you. Misty or Will?
Okay, so here's a little insight into my weird personal brain, but hang on with me just a second. COVID happened and I was home isolated by myself, and I'm a very outgoing person and I need socialization. Growing up, I never had an ant farm. So I went to Amazon and bought a little desk ant farm. Oh, wait, I might have to turn off my background so you guys can see it. But you guys have to not pay attention to anything in, you know, back there. But these are my little ant guys, right? And they have their own little feeding area and they build their tunnels in this blue gel stuff. And it actually, I know this is going to sound even weirder, but we experienced a ton of transition this year within TSPN, and my mind was bouncing all over the place with a million different things. Watching these little guys dig their tunnels was soothing. Like, let my mind focus and watch 60 fire ants build and crawl their way through this really cool tunnel, and they're still alive. I can't keep plants alive, but I can keep ants alive.
Congratulations.
So, yeah, this was actually a really great brain break from everything else going on. I could sit and look at these guys dig and move and lift this gel that's heavier than they are, and it was really amazing. So and really cheap too. So that was my secret to COVID.
All right, Will, you got any ant farms?
I don't have any ant farms, unfortunately, you know. But, you know, COVID actually let me get back to the basics. Being an extrovert and kind of a hyper energy person, you know, I took a lot of the simple things for granted. So, yeah, really focusing in on my self-care, you know. One thing that I actually started doing was getting, you know, I had some exterior plants and kind of enjoyed them. So, of course, the flower farm, I call it, grew. And next thing you know, I'm moving furniture out to bring the plants inside now and to keep them living. But, you know, really focusing in on things that I enjoyed, you know, earlier on in life, you know. Yes, I've always been an outdoor person as well. So, you know, taking hikes and really just getting out and doing yard work when the weather permits. You know, I was blessed with a beautiful little girl at the beginning of this year. And, you know, I'd always say that, well, I get to go home and spend family time. And yes, my family is definitely very vital and important to me. But, you know, those are my responsibilities today. That's not truly my self-care. So really kind of looking and expanding outside the box to, you know, implement my family in my self-care plan and things. So, yeah, we do family hikes. When stores permit, I'm a big thrift store or flea market type person and kind of restoring old furniture and just treasures. So definitely have got to get back into that as well.
Well, that was a lovely way to bring this all the way around. Tony Jackson, I think we have some great practical ideas on how to, increase your self-care and your coping skills, which ultimately leads to increased resilience.